I'm sure you've seen the headlines lately about transgender lactation, but what does the clinical evidence show? So here is our research question. Are transgender individuals able to breastfeed? So let's first look at transgender men. So to be clear, they're born female, but they desire to be male. And so the ability to lactate depends on whether and what type of subcutaneous mastectomy has been done. So that surgery is also called chest masculinization or top surgery. And the goal is to create a male appearing chest, and so sometimes there is some breast tissue that's retained. They also need to stop taking testosterone. So let's look at the types of subcutaneous mastectomy. The most common surgery involves excision of the nipple and areola, which are then grafted back onto the breast, and that's called free nipple grafting. The problem is that leaves little or no ability to remove milk from the nipple. Also, if they do a nipple reduction, then there's no openings for the milk to be removed. There's also risk with that surgery. There is a risk of complication of necrosis, causing the nipple to actually be lost or to actually have another surgery to remove the nipple. Another type of subcutaneous mastectomy is called the pedicle technique, and this is where the nipple, the areola, and the tissue beneath the areola remain in place. And so there will be some ability to produce milk and for the milk to be removed. However, if the duct connections are cut, then that would make milk removal impossible. Now let's talk about transgender women. So they're born male and they desire to be female. So in that case, to induce lactation, they require hormonal therapy and stimulation to the breast. However, despite everything that's in the news, there's actually only a few case reports so far in the literature. In fact, to date, this is 2024, there have been 4 case reports in the literature. Now, let's look at transgender women. Like I said, they would require hormonal therapy. So, high doses of estrogen and progesterone would be given to simulate the hormonal changes during pregnancy to cause breast development. And then, at the time they're expected to start lactating, if there's a due date of the baby, for example, then at that point, the estrogen needs to be decreased. Progesterone would need to be decreased or actually discontinued to mimic the hormonal changes of postpartum to allow the milk production. They also would need to take an androgen blocker like spironolactone, and what that does is decreases testosterone. The other medications that would be needed would be a medication that increases prolactin because prolactin is the hormone that causes milk to be produced. And there are 2 options. One is domperidone. Now, that is not available in the US because it's not approved by the US FDA. So it's usually purchased from Canada, for example. And that medication is actually for nausea and vomiting, but it has the side effect of increasing prolactin. The reason it's not approved by the FDA is it can cause an irregular heart rate and even cardiac arrest. Now those risks are more with taking it IV. In this case, it would be given by mouth, but there are still risks with that. The other option is Reglan, and that medication is available in the US, and that is used to treat slow gastric emptying, so the stomach's not emptying when it should, or acid reflux. It also has some possible serious side effects of uncontrolled muscle movements like muscle twitching and even an irregular heart rate. It also, in some people, can cause them to feel very agitated. Now, you may wonder if these hormones and medications are safe to take during breastfeeding. In other words, does it go through the milk and affect the infant? So, we do know that estrogen and progesterone, when taken by a breastfeeding female, they actually can have a decreased milk supply. Domperidone, they haven't found adverse effects yet, but it's only been in a few breastfeeding moms that they've studied that. And with Reglan, they haven't found any effects either, but they feel like there's not really that many good studies yet. And then spironolactone appears to be safe as well. Now, they would also need to do breast stimulation. So, during the time they're taking the progesterone and estrogen, then they would need to be doing a breast massage and nipple stimulation. And then, about 6 weeks before the due date, actually start pumping the breast, usually with an electric breast pump. And that is to stimulate the oxytocin to be increased, which is the hormone that allows the milk to be released. It also does stimulate prolactin as well, which produces the milk. All right, so let's look at the outcomes for induced lactation in transgender women. So, what they have found is that transgender women usually have smaller breasts and they may not reach the full breast maturity. And if there's not enough breast tissue, in other words, the glands that make the milk, then that is a risk factor for not being able to lactate successfully. So, with transgender women and induced lactation, how much milk was actually produced? So, in these four case studies, you can see that it ranged from 7 milliliters per day, that's about a teaspoon and a half, up to 8 ounces per day. And three of those co fed the baby with the birth mother. And then there was one that actually said that they were able to breastfeed exclusively for 6 weeks, but didn't give a lot of other information on that. So, what was the nutrition of that milk that was produced? So, out of the four case studies, two of them looked at the nutritional value of the milk that was produced and found that the protein, fat, lactose, and calories were at the level of standard breast milk or a little above. So let's look at this interesting case study of a transgender man who detransitioned. So this was a woman diagnosed at age 19 with gender identity disorder, and they started them on testosterone. Then at age 20, they did a subcutaneous mastectomy, and it was the kind with the free nipple grafts. But there ended up being extensive scarring, and that required another surgery later to remove that scarring and actually to remove the nipples. So then at age 24, she detransitioned and she stated that her prior transgender identification and hormonal treatment and surgery was, quote, a terrible mistake. And then at 30, she decided she wanted to have children, so she became pregnant, but she was very distressed that she could not breastfeed. After delivery, the baby was placed on her skin to skin, which is standard practice, and then he looked for her breast. And she said, quote, it was really hard knowing that he wanted to breastfeed and I couldn't give him that. But she was successful in obtaining banked donor breast milk. So here are the author's recommendations. Before chest masculinizing surgery, there should be discussion between that provider and patient about the effects of surgery on breastfeeding. Also, public information needs to be honest about the barrier that surgery does pose to breastfeeding and potential complications. Women that have had chest masculinization surgery need assistance to consider the options for feeding their infants. Here's a list of the references, and I'll have a link in the description that you can go and download a PDF of the references. Do you want to be prepared, not scared of childbirth? Check out my childbirth education classes in the description.